Hi. Are you one of the people that experiences possible addiction? You want to change but so confused, embarrassed, and do not know what to do? You are in the right channel. I hope you will learn something from this video that can help you to start a new chapter of your good life. Recognition of the illness is the hardest thing to do by someone who is unwell and suffering from addiction. Addiction is a complex condition characterized by compulsive engagement in rewarding stimuli despite adverse consequences. It can involve substances, like drugs or alcohol, or behaviors, like gambling or gaming. Alcohol cravings. Feeling of thirst for alcohol. Illegal drugs. The worst and most expensive form of addiction. Feeling excited when gambling. Intense craving to gamble. The feeling of excitement and satisfaction when gambling. Some lesser forms of addiction. Impulsive shopping, excessive internet usage, and sex. Addiction fundamentally alters the brain's functioning, leading to persistent cravings and a loss of control over use. Treatment often involves a combination of therapy, support groups, and sometimes medications to manage withdrawal symptoms or cravings. Addiction is a chronic and relapsing disorder characterized by compulsive seeking, craving, and use of a substance or engagement in a behavior despite harmful consequences. It is often associated with changes in the brain's structure and function, particularly affecting areas involved in reward, motivation, and self-control. Types of addiction. 1. Substance addiction involves substances such as alcohol, nicotine, opioids, cocaine, etc. 2. Behavioral addiction involves compulsive behaviors like gambling, gaming, shopping, and internet use. Key features of addiction. Compulsion, an intense urge or craving to use the substance or engage in the behavior. Loss of control, difficulty in limiting or stopping the use or behavior despite wanting to. Negative consequences, continued use despite adverse effects on physical health, mental health, relationships, or work/study performance. Tolerance, needing more of the substance or behavior over time to achieve the same effect. Withdrawal, physical and psychological symptoms when substance use is reduced or stopped. Causes of addiction. Biological factors, genetics, brain structure, and neurotransmitter imbalances. Environmental factors, stress, trauma, peer influence, and availability of substances. Psychological factors, coping mechanisms, mental health disorders, like depression or anxiety, and personality traits. Addiction poses numerous dangers, affecting individuals physically, psychologically, socially, and economically. Here are some of the key dangers associated with addiction. 1. Physical health risks. Damage to organs. Substance addictions, for example, drugs, alcohol, can lead to severe damage to organs such as the liver, kidneys, heart, and lungs. Risk of overdose, especially with substances like opioids or certain drugs, which can be life-threatening. Increased susceptibility to diseases, weakened immune system and higher risk of infections and diseases such as HIV/AIDS and hepatitis, from needle sharing. 2. Psychological and mental health risks. Mental health disorders. Addiction is often accompanied by or can exacerbate mental health issues like depression, anxiety, or psychosis. Cognitive impairment. Chronic use of substances can impair cognitive functions such as memory, attention, and decision-making. Increased risk of suicide. Substance abuse is a significant risk factor for suicidal thoughts and behaviors. 3. Social and behavioral risks. Relationship problems, strained relationships with family, friends, and colleagues due to behaviors associated with addiction, lying, stealing, neglect. Legal issues, involvement in criminal activities such as theft or driving under the influence, leading to legal consequences. Financial instability, spending large amounts of money on substances or behaviors, leading to debt and financial problems. 4. Impact on employment and education. Job loss, decreased productivity, absenteeism, or termination due to addiction-related issues. Educational disruption, poor academic performance, dropping out of school or college. 5. risk of accidents and injuries. Impaired judgment, increased likelihood of accidents, injuries, and fatalities due to impaired coordination and decision-making. 6. Cycle of dependency. Addiction perpetuates a cycle of craving, use, withdrawal, and relapse, making it challenging to break free without appropriate treatment and support. 7. Impact on family and loved ones. Emotional distress. Loved ones often experience stress, anxiety, and feelings of helplessness or betrayal. Family dynamics. Breakdown of family unity and trust, disruption of caregiving roles. Addressing addiction requires comprehensive interventions that not only focus on stopping substance use or modifying behaviors but also address the underlying factors contributing to addiction. Early intervention and ongoing support are crucial in mitigating the dangers associated with addiction and promoting long-term recovery and well-being. Treatment of addiction. Behavioral therapies. Cognitive behavioral therapy, CBT, motivational interviewing, ME, contingency management, CM. Medications, used to manage withdrawal symptoms, reduce cravings, or treat underlying mental health conditions. Support groups, such as Alcoholics Anonymous, AA, or Narcotics Anonymous, NA. Inpatient or outpatient programs, depending on the severity of addiction. Challenges in recovery. Relapse, common due to the chronic nature of addiction, not a sign of failure but a part of the recovery process. Holistic approach, addressing physical, psychological, and social aspects of addiction for sustainable recovery. Long-term management, ongoing support and monitoring to prevent relapse and maintain sobriety or behavioral control. Understanding addiction involves recognizing its complexity and the need for comprehensive, personalized treatment approaches tailored to individual needs and circumstances. The journey to recovery must come from within you. You need to fight the cravings and discipline yourself. Make your mind strong and fight the addiction. It is you that is the best and real cure. There are no therapy, medication, or program that can control your addiction. Only you. Please support my channel. Kindly like and subscribe below. Thank you for watching.